Humans fear no animal more than the snake. In the United States, there are only around 6 deadly bites per year. How can a creature that hurts so little cause so much revulsion?
It was the beginning day of pheasant hunting in South Dakota. We started out on the hunt, walked across a field that had been tilled up and was all dirt, and about halfway across the field, a friend of mine said, "Look out." And I looked down and there was a old big prairie rattler laying there, and the temperature was pretty cool that day, so he was kind of dormant. He was laying there, nice big fat snake. I thought it would be cool to pick up the snake and have somebody take a photo with me. And the mistake I made, well, probably the first mistake was picking the snake up, but I picked him up instead of on the head in his jaws, I picked him up on the neck behind his jaws. So he was able to turn, and he turned and fanged me on the finger, fairly deep, full of clear liquid. So, you know, I'm thinking John Wayne snakebite treatment, and I took the poison in my mouth and tried to suck it out and spit. That was a mistake because I'd been eating potato chips and roughed up my mouth, so I just drew it into my mouth.
Any venom is basically a poison, and a venom is by definition injected into its recipient, whether it's a potential predator or its prey. In the case of pit vipers, like the rattlesnake, it's injected through 2 hypodermic-like fangs that are situated in the front of the mouth that have a great deal of mobility to them and can be directed with great precision by the snake itself. The venom is nothing more than modified saliva, which has its ecological equivalents in other species of animals, other classes as well. Some venomations are mild, and you just get localized swelling and pain. And so you don't really get extension of the bite proximally to the upper portion of the extremity or to the trunk. In serious envenomations, that can happen very rapidly, where you have swelling and systemic evidence of involvement of the venom, where people start losing their blood pressure, their pulse rises, or shows that the venom is now rapidly spread through different parts of the body. You look at the patient clinically as well as with laboratory to determine what degree of envenomation has occurred. Typically, if you start seeing swelling that's spreading in a reasonable fashion from the bite, then you can assume that at least a moderate envenomation has occurred, and that would almost certainly necessitate the initiation of antivenin.
The same toxins that are injected by some snakes are the same toxins that are used by the medical industry to produce antivenin. Kentucky Reptile Zoo, outside of Lexington, is one of only a few facilities capable of producing adequate amounts of high-grade venom.
In order to extract venom from a snake, you have to convince it somehow to bite onto a receptacle. And unfortunately, you can't just explain to the snakes, "Hey, please bite this." So it involves picking them up. And in order to do that, you take the snake out of the cage. We always use a tool. It is pinned down, which basically is pressing it on the head, and picked up behind the head. It's actually a very small tolerance for being safe when you pick them up, so you have to pick them up exactly right. And then they're allowed to bite onto a funnel. The funnel is held in a podium over a glass vial, and the snake bites onto the funnel, the venom runs down into the vial, and then the snake is returned to its cage. Once we have the venom that's been extracted, we take it and freeze it, and then typically within a week of extraction, it is lyophilized. And that's a big word, but all it means is it's freeze-dried. And it leaves behind a crystal that looks a lot like yellow salt once it's kind of broken up, or a yellow powder. In that form, it's actually stable for a long period of time. It can be shipped around without any extra refrigeration, and so it just makes it easier to work with. Researchers can reconstitute it at the concentrations that they want, so it just makes it a little bit easier to deal with and safer long term.
Antivenin production is a relatively simple process. Small quantities of pure venom are injected into a host animal, usually a sheep, and over time, the animal will produce antibodies. These antibodies are the medicine bite patients receive through an IV.
Snake bite treatment is by far, with the use of antivenin, the most effective method of treating envenomation. Medical treatment is by far and away the most effective. We reserve surgical treatment for cases where there's what we call compartment syndrome, where, for example, the swelling of the limb is such that it compromises the blood flow to the distal part of that limb, or it compromises the neurological flow and function. In that case, a fasciotomy is done to release pressure, and that's a temporizing measure, but you're always using antivenin at the same time.
Right after the bite, I felt my tongue start to get a little numb, and it really concerned me. So from the time I was bitten until I got to emergency room, 40 minutes. So I was what I describe as gurgle talking, kind of like that. All the digits on my hand were exaggerated and swollen, especially, of course, the one with the bite, but even the adjacent. The hand was very, very swollen, and the migration of the venom, which shows up as red coloration, was starting to migrate up my arm. Then some real bruising started to occur on the underside of my arm and on top of my hand.
When somebody comes in and envenomated, then there's sometimes the opportunity to educate depending upon their clinical status. If they're in significant pain, I'm not educating, I'm treating. If they're resting fairly comfortably and I can talk with them at length, how did the bite occur? Well, let's think about this. Sometimes it's truly an accidental bite. You're walking the wrong place, you put your hand somewhere where you shouldn't be while you're hiking, and you get bitten. Most of the time, it's because you're doing something you probably oughtn't to do. And that's the potential window of educating. Of course, they knew that, and they knew they were doing wrong. So whether or not that has any real effect is a different matter altogether.
It is always better to educate before tragedy strikes, not afterward. For Tim Cole of the Austin Herpetological Society, education is a big part of his job.
Snakes are not out to get people. They want to get away from you. They want to be left alone. I've been catching snakes since I was 5, 6 years old. And I'm here to tell you, every single one of them, as soon as it saw me, it went the other way. It was me chasing them, not them chasing me. Snake's brain tells them, I've got to get away. This is a predator. And I know there's a hole or a log or a rock right behind that person that I'm safe in. And that's where they head for. Quite often I'll hear from people that live in a new neighborhood that they've got snake activity because they've invaded their environment. Or you've got an older neighborhood that has a new neighborhood going up next to it. And once again, they're pushing the snakes out of where they were comfortable. And the old neighborhood starts to see snakes. Sometimes they're curled up on the front porch or on a step because they're kind of misplaced. They don't know where they're going to go. Once they figure it out, they hunker down and they try and stay away from a lot of human activity. Walk away, leave them alone. They're going to leave as soon as you leave.
A snake's main concern is staying hidden and eating. The western diamondback rattlesnake spends most of its day in a warm but shaded spot. The famous rattle on the end of its tail is used only to warn potential predators away. The muscles that move the tail fast enough to make the rattling sound are some of the strongest in the animal kingdom. Once the snake feels secure enough that its foe is gone, it will crawl away to find another hiding place.
All snakes that crawl around and live and breathe just like we do They're creatures and they have their purpose. Even the venomous snakes do. I don't dislike snakes now. Probably more interested in them. Within the last 6 months, I encountered a man who does attempt to pick up rattlesnakes, and I warned him not to, by sheer virtue of the fact that my experience in getting bit by a rattlesnake wound up costing about $80,000, and thank goodness I have great insurance. Of course, I had to cough up some of that, but it's ridiculously expensive if you get bit by a rattlesnake and have to be transported. Best not to do it all.
Snakes are a vital part of their ecosystems and should be left alone to live their own way. Thanks to the marvels of medical science, we no longer have to fear these creatures with our lives. Snakes should be respected and admired, but preferably from a distance.